My name is Dr. Gikere. I currently serve as a health risk advisor at Minet, Kenya. I am currently involved and actively engaged in matters around health financing, health adjudication, and all matters health, just to make sure that we have a healthy population for the country. The days are never similar. There's always something new to do. However, I would divide them into some specific themes. There's always a theme around adjudication. There will always be a theme around health financing and the health economic bits around health financing. And there will always be some advisory services given to corporates just to be able to improve and help them get the best out of their health covers and to just generally improve on their health outcomes. Minet brand is all about expertise. Minet brand is all about easing people into a certain sense of comfort and a certain sense of know that they have the best brains and the best form of information behind them to just guide them through the steps and to help them make the right decisions when it comes to matters insurance, when it comes to matters risk, and all other things that you would think about within a corporate and within a personal kind of an environment. I am a compassionate leader. I am a listener. I heavily encourage a lot of teamwork, and I would always want to hear what the team members have to say on how we can solve problems. I do believe and I do think that no man is an island, so we all have to come together just to be able to achieve the goals that we ought to achieve at that particular point in time. No day is like the other. There are always new challenges coming up, and going through the problem-solving matrix really enlightens you. It gives you new ideas and it shows you how you can be able to solve problems in various and in different manners. The logical and the critical thinking is something that I really have improved on this particular role, and that is by far the best thing that I would say Minet has done. Going all the way back to, I think, my fourth year of medical school, I knew practice was not really for me. I somehow knew that I would end up in a health economics, in a more mathematical kind of a field related to healthcare. So for where I am, I didn't really think risk in healthcare existed up at least until I came to know more about Minet. But yes, I have really gelled in. This is the right place for me. Policy, driving around the health econometrics and the health economic principles around healthcare, just to make sure that we have a lively and an active healthcare market, is where my passion actually really lies. We are all about cost effectivity. We want the biggest bang for the buck. We want to make sure that whatever service is offered, whatever form of service you go through, we get something out of it in return. So for that, we have the cost element and we have the outcomes element. That is domiciled in the effectiveness bit. So we are continually looking at claims. We're continually looking at the output from facilities, just to make sure that people are getting the most out of it. In addition to that, preventative and promotive forms of healthcare are also very big. So we are heavy on wellness, we are heavy on the WASH principles, just to make sure that the working environment is actually safe, because by far and large we spend majority of our time at work. So if you can make that particular environment really safe, if you can make that particular environment really good, we can be able to get the most in terms of healthcare outcomes. A chill guy. I don't usually have so much to say. I let my work do the talking. I'm very big on knowledge. I think they would describe me as chill and knowledgeable.